I'm EZRAH reporting on the hottest issues and the biggest stories. This is the Manila Times. A new COVID-19 variant has entered the country. The Department of Health, or DOH, reported the first case of Omicron subvariant FE.1 in the Philippines. According to DOH, FE.1 is an Omicron XBB sublineage. The variant was initially flagged for its increasing global prevalence and has been detected in 35 countries or jurisdictions across 6 continents. The World Health Organization has declared an end to the COVID-19 global health emergency. But why are we still plagued by new variants? Joining us is OCTA Research Fellow Dr. Guido David. Welcome to the Manila Times, Doc. What are the symptoms of Omicron FE.1, and is it stronger than the past subvariants?
Yeah, actually, I was not giving too much attention to the FE.1 when I first saw the latest biosurveillance data from the Department of Health and the Philippine Genome Center. I believe this was conducted from May 29 to June 12, just this past June 12. And there was a number of subvariants detected in that biosurveillance. Actually, marami-rami siya na inaipon. And from what I saw, I think 83% of the cases which underwent genome sequencing, 83% were from the XBB types. So kasama dito yung XBB 1.5, which has been in the country for some time now, and then XBB 1.9.1, ito yung pinakamarami, 32%. 16% sa yung XBB 1.5, and then 9% sa XBB 1.16 or the Arcturus, 8% from the XBB 2.3 or the Acrux, 4% from XBB 1.9.2, and then another 14% of other XBB types. Kasama dito yung na-mention mo na Omicron FE. Although iba na yung letters niya, it's actually part of the XBB lineage. And I was checking so one case of FE, it's not clear where in the country this was detected. And I was checking the latest data from the European Center for Disease Control. And this is a variant under monitoring, itong FE.1. And as we mentioned, it's part of the lineage of XBB. There have been some cases detected in some parts of Europe, but the information I have is very limited. So unlike yung others, like yung 1.9.1, yung 1.5, and then yung 1.16 and 2.3 na medyo common siya in other parts of the country. So based on the limited information that we have, it seems like the symptoms will not be that different from the other XBB types that have been circulating in the country. So usually flu-like symptoms, kasama yung headache, body aches, joint pains. So flu-like symptoms would also include possibly fever, cough, and runny nose, sore throat. Yan yung mga common. Or it could also be diarrhea. Yung Arcturus, it also included pink eyes or conjunctivitis as a symptom. But I don't think it's common sa other XBB types. But we will see. Again, we're right now working with very limited information about FE.1.
Sir, regarding the latest genome sequencing, you mentioned there were a lot of subvariants, and the FE.1 is the least of our concerns. So out of all those latest genome sequencing, ano po yung pinakamataas na kaso? Which variant po?
Okay. Wait. I'll be careful to say I wouldn't say that it's the least of our concerns. I mean, yes, it's we just had one case, but we don't have much information about it yet. So I'm just saying that I'm not overly concerned at this time. But we are keeping a close watch on this subvariant because we don't know a lot about it, and what we know can change, and it could potentially be something infectious like the other subvariants. So right now, some of the most concerning in other parts of the world, definitely yung 1.5 and yung 1.9.1 na XBB, and also the Arcturus, yung 1.16. And these are already the ones that are well, they're the most prevalent right now in the country. So concerning in terms of number of cases sequenced, and we noticed yung Arcturus ay tumaas siya compared to the previous times that there was biosurveillance conducted. So dumadami yung Arcturus or yung 1.16. Pero dumami rin yung Acrox, yung 2.3 na XBB. And some of these are variants under monitoring. Some of these are variants of interest. But again, we'll continue to monitor these.
Sir, why are there recurring instances of subvariants po, ano? Since the WHO, the World Health Organization, had just declared an end of COVID-19 pandemic as a global health emergency. But when are we going to see the last of this virus? Kasi parang it seems like every month there's a new variant coming up.
And in fact, unfortunately, dumadami itong mga variants eh. I remember back in 2020, the first variant came out, and it was months after the first wave of the virus. And then in 2021, there were a number of variants that came out, kasama ng Delta and yung Alpha and yung Beta. But maybe there were at most 10 variants at that time in the whole year. Pero ngayon, every month we have new variants. And it's getting more common because it's no longer considered a public emergency. So a lot of countries, especially Western countries, have moved on. So meaning, they no longer wear face masks, or they're just allowing the virus to circulate. When you allow the virus to circulate, there will be more instances, more opportunities for mutation for the virus. So talaga magkakaroon ng mutations and parami ng parami. In fact, now we can, we can hardly keep up with the mutations. Sa sobrang dami. Even me, I get confused with some of the new mutations. So I don't think it's gonna stop. So it's like the flu virus. It's still here. The flu virus, we don't consider it an emergency, but it's being allowed to circulate. So every year, mutate yung flu virus. So I think we just have to live with the virus. But for me personally, living with the virus doesn't mean that we let our guards down. We can still opt to protect ourselves. I still see a lot of people wearing face masks, even outdoors.
Sir, is there any way that to permanently get rid of COVID-19, or is that, like you said, it will be something we have to learn to live with?
Well, there's probably a way to get rid of it permanently, but we haven't found the solution yet. I think maybe there could be a treatment that could be developed. Of course, yung treatments ngayon are they are treatment. They're not designed to prevent, but they're designed to treat. There might be a way in the future, but or it could be that we just have to live with it, just like the flu virus and the dengue virus. We can't get rid of dengue. Every year there's going to be a wave of dengue. Every year there's a wave of flu. Every year there's a wave of TB. So because of how fast the virus mutates, and because of how we have decided to just accept the virus, in the world, I think we missed the opportunity to get rid of the virus. I think that was early during the pandemic. Maybe we could have tried to prevent the virus from spreading and basically killed it. But unfortunately, that requires a global cooperation among many countries. So kahit na mag-lockdown tayo dito, just like what China did, nag-lockdown sila for years, for a few years, eventually they had to open up because there's a lot of there's tremendous economic pressure to open up. Pero during the time now when it was under lockdown, if all the countries were also trying to control the spread of the virus, maybe we could have prevented it from spreading further and basically, killed it. Or maybe not. Maybe it's impossible. So it's hard to tell actually. So maybe talagang hindi talaga kayang patayin yung COVID, yung SARS-CoV-2. But again, we're just looking back. Not much to do right now. We just have to live with it, accept that it's here. But of course, I mean, I don't think it's like the flu virus per se, just like what some countries are saying or some governments are saying. I mean, not us, but in other parts of the world. Because as we know, there are long-term effects of COVID. And, we have to live with it because of also economic pressure on our country. But, I don't think that we can safely say that it's just like flu or parang trangkaso na lang right now.
Sir, what is your advice to the public? And would you recommend getting the second booster?
Well, the DOH and the FDA will have to make that recommendation, and the recommendation will depend individually then. So if someone wants to get the booster shot, they have to consult with their physician. But at least my opinion is, if we're eligible to get the boosters, and if we want to get the booster, we should get it once these vaccines come in. The bivalent will have more coverage compared to the original virus. But then again, yung XBB, I mean, yung bivalent will cover the original Wuhan strain and the Omicron. So malaki ng coverage niya. But the latest are XBB types, as we mentioned a while ago. 83% of cases here are XBB. So I hear there are already newer vaccines which are trivalent. So it's the original Wuhan, the Omicron, and also designed for the XBB types. Kasi ito na talaga yung latest itong XBB. So all the variations we talked about, yung mga Arcturus, yung FE1, they're under XBB types. So if we have a vaccine for XBB, that will cover these different types of XBB.
Thank you so much, OCTA Research Fellow, Dr. Guido David. Thank you so much for your time, Doc.
Thank you, EZRAH.